Hello, everyone. I am Camellia, an APRN, a psychiatric mental health nurse practitioner, also known as a PMHNP. I'm a nurse enthusiast and coach, and I've shared a few videos related to the PMHNP role, some questions that I've gotten along the way. I've tried to address those, and today I wanted to get on just briefly to talk about where can you work as a PMHNP? What places can you work in your role as a PMHNP? So most of you know that I've been practicing in this role, for about 4 years, and most of my career thus far as a PMHNP has been outpatient. And so I'm just going to talk a little bit about where you can work, the different opportunities that you may have. Maybe you are a student, a PMHNP student, and you're at a point where you're already considering where you can work, what options or opportunities you may have once you graduate. But you could be also a person who is considering the PMHNP degree or certification, and you just want to know more about the role in itself and where you would possibly be able to work. So I'm just going to share a little bit about that here. So I'll put these places that you can work in a larger scope and term them as inpatient, outpatient, and community. And that'll make sense in just a minute. But when we think about places that you can work as a PMHNP that are inpatient, I'm referring to my notes here, but you can work in an acute care facility. So that looks like a standard traditional behavioral health unit where you are seeing patients usually on a daily basis. They're seeing a provider, but they have been admitted to an inpatient unit for a psychiatric or mental health reason. And there's lots that fall in that scope. Most of the time, it has to do with stabilization and, most importantly, safety for those patients. So they're kept for a little bit. They're stabilized. But as a PMHNP in that scope, you would be seeing those patients as one of the providers while they're under the care of the hospital. So that's one example of inpatient. Also, there's the emergency room, which is where I do some PRN work. And there, as a PMHNP, you are really looking at patients as they come through the door. You're doing an assessment. You are working with a larger team, as I've shared in a prior video, to make a decision about whether that patient can be discharged safely, whether they need to be kept for a little longer for closer monitoring, or do they need to go up to an inpatient acute care facility, like I just mentioned, or a unit, so that they can be monitored, stabilized, and until it's safe to discharge. So in that realm, you are seeing patients a little bit more frequently. You're not developing necessarily a relationship with patients because they are in and out, but you are making a decision based on what you gain from the patient and based on what team members are able to offer from their assessment with the patient. And by team members, I mean social work, sometimes medical providers, when they come in for something that could be a medical diagnosis versus a psychiatric diagnosis. And then you're making a decision about what should happen, the disposition of that patient. So that's the second sort of opportunity that you have that falls under like an acute care realm. And then you have what we consider bridge programs. So bridge programs, one example of that is called a partial hospitalization program, and the other is called an intensive outpatient program. So you, as a PMHNP, you'll hear the terms PHP, which is partial hospitalization program, and IOP, which is intensive outpatient program. It looks a little different depending on your state, depending on the facility, but just the gist of that work as a PMHNP, what you are doing is you're seeing patients that require more intensive care. That can be an adolescent, that can be an adult patient with various diagnoses, but they were requiring more intensive or more care, meaning more contact with that patient to offer more support. So they aren't staying overnight in a facility, but they are requiring, based on what's going on with them, to be seen and evaluated on a more frequent basis. So a lot of partial hospitalizations and or IOP programs, they are different, but they do require the patient to actually be committed to coming to their facility, usually 3 to 5 days a week, and that's usually a full day in most instances, from 4 to 8 hours, depending on the program. Then you can specialize in those areas. So when you're seeing those patients, some of them are specific for substance abuse. There are programs, of course, that are considered residential treatment, where you're actually seeing someone who is really, they're staying in another facility that's not a hospital, but example would be like a rehabilitation facility for substance use. That would be a residential program. There are residential programs that exist outside of the use of substance abuse. But in that instance, you would be developing a longer rapport with patients, seeing them more frequently, and you get to know them because they're actually in that facility for an extensive amount of time. That's another example. Eating disorders, sometimes there are programs specific to that for residential treatment as well, where the patient is actually staying at the facility. These are, again, usually facilities outside of the hospital that are designated just for this type of treatment, whether it's substance abuse treatment or eating disorders. So those are just two examples of what we would consider residential treatment. I've talked about the ED. I've talked about partial hospitalization programs and IOP, or intensive outpatient programs. So moving to the next group or subset of facility types of places that you can work is outpatient. Okay, so outpatient, that's pretty traditional with your outpatient clinics. From there, you can differentiate between private practice, and private practice you can work in places like a wellness clinic, which is what I do outpatient as well. And I'll share another video about the perks of private practice and kind of some of the things that look a little different from your traditional clinics. Also, telepsych is sort of its own thing, because telepsych can exist in inpatient or outpatient or these bridge programs that I've talked about. I will tell you that telepsych is growing. I think, as with everything else, COVID-19 has shown us a lot. It's shown us some ways that we can help patients safely, because safety is a huge piece of mental health care. And so telehealth has shown us, COVID-19 has shown us how telehealth can be possibly useful. With that said, you can be a telepsych provider, usually inpatient or outpatient, or the emergency room, where you're seeing a patient over a monitor, or a video device, where you're able to still talk to the patient. You can't fully see the patient and fully grasp everything about the patient, but you are able to gain information to help guide their treatment. So telepsych, again, that's an area in high demand right now as a PMHNP, and there are some perks to that as well that I'll talk about in a later video. I'm actually in the process of onboarding for telepsych right now, and it's quite interesting, but it's great to be in a space to be able to help more people than we've been able to in the past. I will also say that telepsych may be an area that you would consider after you've had a little bit of experience just working with patients face to face. And that makes sense probably to most of you, but in mental health as a provider, a lot of what you're doing is paying attention to body language. You're learning kind of what that looks like for patients. And so some of that can be a little bit subdued when you are on a video monitor with patients. The other thing about telepsych is that it's not going to be for every patient. So for your critical patients, telepsych, most of those patients will not be, they won't be candidates for telepsych. So keep in mind that you're only going to see maybe a subset of diagnoses or conditions, because every patient is not safely a candidate to be a telepsych patient. And there's more to come there. I'll share another video specifically about telepsych as well. The other area that you can work in is in the community. And by that, I mean that there are teams that exist that go to the patient and help the patient in terms of their treatment. So examples of that are your ACT team and sometimes mobile crisis. There's a lot of different names in other states, but in that instance, what you are doing is you're going to the patient. And that's really helpful for a patient who has a chronic mental illness or condition that impedes their ability to care for themselves properly or appropriately, or they have other things that are leading to them not being able to adhere to their treatment. So as a provider on something like an ACT team or community care team, what you're doing is you're going to the patient, you're offering them, an assessment, evaluation, diagnosis, and then you're also treating them in the community. And so, again, that's going to be for your chronic patients, patients that have had challenges with adhering to their treatment. You'll be working with a team. This is where teamwork is very, very important. Sometimes that looks like a therapist or a counselor. Sometimes it looks like a therapist or a counselor. And then you're also working with like social work, because a lot of these patients, their care is impeded by their housing or a lot of the social components of their lives. So that's another umbrella. And there's also the opportunity, of course, for education and to offer consulting services. So that is an area where you may be able to offer, treatment to patients for medical providers, or offer support to medical providers. As we know, psychiatry and mental health is a specialty, so sometimes consulting and working on a consult service can be helpful there. Just offering support for patients that need psychiatric treatment. Of course, in some instances, just a referral is necessary, but there are some models out there based on the different facilities that I've worked where they actually do have psychiatric consults that see the patient if they're not in for as a primary diagnosis being a mental health condition. And of course, outpatient, there are models that you can work with a therapist, therapists who are looking for providers to provide medication management. So those are just a few. Inpatient, you've got residential treatment, you've got outpatient, you've got community care, you've got consulting. So those are just a few. I work in 3 of those areas, the emergency room occasionally. I also work outpatient, and again, delving into telepsych as we speak. I'm hopeful this was helpful to someone. Please send me a message or comment below if this was helpful, or if you have other questions or would like me to elaborate on any of this. I'm just sharing this to give you just a little bit more of a snapshot into what the PMHNP role is about and what we do. So let me hear from you guys, and you guys have a great day.